hope you guys are doing well. This is Dr. Nicole Edwards, board certified family medicine physician. I am the CEO and founder of Abundant Life Concierge Medicine and Abundantly Natural, all healthy, all natural vitamins and supplement line. And this is Talk with the Doc. This is our weekly show that we do for all things health and wellness. So I thank you guys so much for joining me today. Today, it is the month of May, and so we are kicking off National Mental Health Awareness Month. So that's what we're going to be discussing today. So if you know someone that needs to learn about mental health awareness, if you know someone that's dealing with mental health issues or concerns, please go ahead and share this video with them, or go ahead and invite them to join in. We're not going to be before you long today. Just a quick introduction to the month about all things mental health awareness. So like I said, I am Dr. Nicole Edwards. You have tuned in to Talk with the Doc. This is our weekly talk show where we talk about all things health and wellness. I am a board certified family medicine physician, and I help veterans and busy professionals to live their best whole person healthy life. That's mind, body, spirit, and finances. So please, thank you for joining me. Please click like, share, and follow on our YouTube page. We are here live every Sunday afternoon on YouTube. All right, let's just jump right in. Like I did tell you guys, I do help veterans with their whole person health, and but not just veterans, also like I said, busy professionals, and really just the general public in general. I break down hard to explain mental and physical health conditions in terms that everyday people can understand. Because it is Mental Health Awareness Month, I do want to discuss mental health, all right, and shed some light on what's going on with mental health. All right, so I do want to read to you guys a couple of stats that I have. This is the state of mental health in America, all right? Mental health. And you know, mental health is anything dealing with our mind, our brain, our ability, our emotions, all right? Our ability to express ourselves. So this is mental health. This is a critical part of overall wellness. It's a part sometimes that is often forgotten, but I tell people all the time, we are one being, but we're made of three parts. And if one part is unhealthy, then the rest of the parts are going to be unhealthy as well. All right, that's where dis-ease or disease comes in. So if our mental health is not correct, then our physical health is not going to be correct. Same vice versa. If our physical health is not correct, then our spiritual health is not going to be correct. I don't know of any person, I tell my patients this all the time, I don't know of any patient of mine or person who is dealing with a chronic medical condition who it does not affect their mental health, does not affect their psyche. When you are, let's say, have diabetes and you have to worry about your blood sugars, and so that can cause some anxiety, all right? When you have chronic migraine headaches and it causes pain, that can cause some depression because you're hurting all the time, or you're not able to do the things you used to do. So you have a lack of ability to express yourselves and enjoy life the way you used to. That can bring on some dysthymia, which is like mild depression, or some full-fledged depression. All right. So why is mental health so important? Because it is critical for the rest of our health. All right. So let me just read to you guys. I wanted to read you guys some of the findings. This is an article about the state of mental health in America. All right, and these are the 2022 key findings. It says in 2019, just prior to the COVID-19 pandemic, 19.86% of adults experienced a mental illness. That is nearly 50 million Americans. 50 million, guys. This is very common, very common. I don't want you to feel isolated. I don't want you to feel like something is wrong if you are dealing with some mental health issues, all right? Just like I tell people all the time, we can't fight or villainize someone whose blood sugars are out of control. We also can't villainize someone whose blood pressures are out of control. We can't villainize someone who maybe their spine is curved with a scoliotic curve with scoliosis. We don't villainize those things, right? We just deal with them because that is part of our health. Same thing when it comes to mental health. I think the problem has been over time, what we've done is we've villainized mental health. Oh, you're not praying enough. Oh, you're not sleeping enough. Oh, you're not taking care of yourself enough. Oh, this is something, oh, you'll get over it. Oh, this is something, this is little, right? Or, oh, that's just the way he is. That's just the way he's always been. Oh, you know that runs in the family. That, we can't villainize mental health conditions because oftentimes what it is, It is a uh, our brain chemicals, okay, like norepinephrine, epinephrine, dopamine, serotonin, those chemicals in our brain, sometimes those can be deficient or it can be too much. And when you have not enough or too much of the brain chemicals, it can cause some mental health conditions such as schizophrenia or depression or anxiety or insomnia, PTSD. All of these things are mental health conditions. So we know that 50 million Americans in 2019 experienced a mental illness. And we know that dealing with COVID and the isolation and all that we went on, all of the grief, all of the loss, those numbers went up exponentially. All right. This next one says suicidal ideation continues to increase among adults in the US. Now, suicidal ideation does not necessarily mean that you have a plan that you're going to, that you're thinking about going to go out and act on to end your life. Suicidal ideation is thoughts, though, of things like the world would be a better place if I wasn't here, or if I wish I could just lay down and go to sleep and never wake up. All right, it's not necessarily a plan, but it's just thoughts that maybe things would be easier on others or maybe even on yourself if you were not here. All right, and so it's very different from suicidal a plan. Okay, where with the plan we have to get you help right away. Ideation, we do want to get you help as well, but we know that there is a difference. But it says suicidal ideation continues to increase among adults in the United States. Almost 5% of adults report having serious thoughts of suicide, which is an increase of 664,000 people from last year's data. All right, now remember, this is the data for this year. It said the national rate of suicide ideation has increased every year since 2011. All right, this was a larger increase than seen in last year's report, and it's a concerning trend to see going into the COVID-19, or as we're coming out of COVID-19 pandemic. All right, there's another interesting thing here. It says a growing percentage of youth in the United States live with major depression. 15% of youth experienced a major depressive episode in the past year. 15%, guys, 15%. All right, that was a 1% increase from the previous year. All right. It says even in the bottom ranked states, 19% of the youth in the bottom ranked states experience major depression. And these are the ages of 12 to 17. All right. This says over 2.5 million youth in the U.S. have severe depression. Severe depression. All right, guys. This says over half of the adults with a mental illness do not receive treatment, which totals over 27 million adults in the United States who are going untreated. 27 million adults going untreated with mental health illness. What do they say? They say check on your strong friends. Those are the ones we need to be worried about. The ones that always have a smile on their face, the ones that always seem to have it together, always seem to be okay. Those are the ones we got to check in on, okay? Because sometimes it can get a little bit of that, what's the song from Encanto? Pressure like you drip, 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 but it just don't stop. That pressure can get to be heavy, and that heaviness can weigh on people, all right? So check on your strong friends, all right? Sometimes they're not okay. Check on the people that are joking all the time. Check on the people, check on everybody, all right? Check on everybody. This says over 60% of youth with major depression do not receive any mental health treatment. 60%, guys, 60%. This says nationally, fewer than 1 in 3 youth with severe depression receive consistent mental health care. These numbers are they're stifling. This says both adults and youth in the U.S. continue to lack adequate insurance coverage for their health care or the mental health care. All right, and this says rates of substance use are increasing for youth and adults even prior to the COVID-19 pandemic. All right. So we know that there are the numbers of mental health conditions and the care for mental health is getting lower. And I think a lot of that has to do with the stigma attached to mental health. I think a lot of people wait too long to get their mental health looked at or to get it addressed. I think a lot of times we try to fix things on our own, okay? Just like we do with sometimes with our blood pressure. Oh, it's only a little bit elevated. Oh, we're only a little bit not feeling well. Oh, we only can't get out of bed. That was just because of this situation that we went through. But I'll get over it. I'll get better. I'm gonna get through this, right? Oh, I know I'm sad and crying all the time, but I'm going to pull myself up and I'm going to get through this. I'm going to pray more. I'm going to go to church more. I'm going to sing a happy song. I'm going to fake it till I make it. Guys, we have to address mental health because it can spill over into every area of our lives. What we're going to be talking about for the rest of the month, each week I'm going to take a topic that mental health conditions can affect. All right, when I work with my veterans on getting them their service connection and getting them a higher rating, a lot of times we are looking at, because there's a large percentage of veterans, a large percent, over 75% of veterans who are dealing with mental health conditions. All right, and a lot of times that can be related to what happened in the military. Okay, and a lot of times it can be maybe it was diagnosed in the military. Remember, service connection, if my veterans, if you're watching, if you're a veteran or if you know a veteran, if you're trying to get service connected for a mental health condition, it had to either have been diagnosed while you're in active duty, or we have to be able to link it back to something that happened because of active duty. All right, so when my veterans come to me and they're dealing with things like PTSD, that's post-traumatic stress disorder, from all the stuff that they saw while they were either deployed or at war, or if they feared for their life, all right, or if they're dealing with a mental health condition like depression or anxiety, all right. Insomnia even is considered a mental health condition when it comes to VA service connection ratings. So all of these things are things that they can be service connected for, and service connection can range anywhere between 30% and 70% most of the time in veterans who I'm helping with. Sometimes with just dealing with insomnia because of another mental health, because of another condition, that can be a 30% rating, and a lot of veterans don't know that, all right? But because of the mental health conditions like PTSD, depression, anxiety, insomnia, these can lead to other mental health, other physical health conditions, okay? So things like what we're going to be talking about this month, things like migraine and tension headaches. We're going to be talking about acid reflux, or GERD, that's gastroesophageal reflux disease, all right, also known as GERD. That's that acid reflux and the heartburn that you get. That, along with irritable bowel syndrome, those can be linked to our mental health, all right. Things like I'm forgetting my list. We're going to be talking about GERD and IBS, headaches. Oh, all over body pain, because they call it somatic symptom disorder. So when your body just aches because of mental health conditions, sometimes if you're severely depressed or dealing with PTSD, you're not sleeping well, your body can start to hurt and your body can start to ache. Remember I said your mental health can often spill over into your physical health, and then your physical health then spills over into your mental health. And so it's like this never-ending cycle of either mental health conditions or chronic pain can also be one. So a lot of times I'm helping veterans get address their physical health, as well as getting them service connected for physical conditions that come as a result of their mental health conditions. So these are the things that we're going to be talking about this month, okay? I do want to bring to your attention that we are sponsored, Talk with the Doc is sponsored by Abundantly Natural. That's our all health and wellness vitamin and supplement line. You can go to drnicoledo.com. That's drnicoledo.com/shop. And you can go and look at all of our mental health supplements that we have. Some of my favorites ones are like Chillax. I have one called Woosah. I have one called, there's one that's Relax, Relate, Release. We've got quite a long list of vitamins, supplements that are available for mental health conditions. If you go and on the right hand side of the screen, there's a option that says search by health concern, and if you pull it down to the mental health, then you can see all of our different supplements that help. We've got all kinds of natural things that have like serotonin or 5-HTP, things like L-theanine, or GABA. All right, these are the things that help give a calming effect, or sometimes it can even help give you a little burst of dopamine, a little burst of energy. All right, so I want you to go and check that out, drnicoledo.com/shop. Go to all of our mental health supplements, and each week here on Talk with the Doc for the month of May, we're going to be highlighting one of those supplements. Like I said, some of my favorite ones are Chillax and Woosah, and then there's even adrenal stress and energy relief. And so you guys just check those out. They're great supplements, and they help to bring this calming effect. Sometimes they give you a little bit of energy if you need it too. All right, so thank you guys so much for joining me today for Talk with the Doc. Again, this is National Mental Health Awareness Month, the month of May. And so if you are dealing with some mental health conditions and you need some help, please reach out to a provider, to a therapist, to someone in your area. Certainly, if you need some recommendations, you can always go and look us up online, drnicoled.com, and you can get all the information for the therapists and the resources that we have through Abundant Life Concierge and Abundantly Natural. And we will join in again on Talk with the Doc for the rest of the month. And each week we're going to talk about a physical health condition that is affected by mental health. All right. I wish above all things that you guys prosper and be in whole person health. All right, even as your mind and your soul prosper. All right, so please click like, share, and follow on the YouTube page. It's Dr. Nicole D.O. on YouTube. Follow me on all social media platforms. And as Miss Tina, who's the therapist through No Shame Counseling, I'm gonna see if I can get her on this month as well. But as she says to others, be kind to yourself. All right, and I wish above all things, again, that you prosper and be in health. Thank you guys so much for joining me today for Talk with the Doc. We will see you next week, where we're going to be discussing migraines and how it affects your mental health and how it's affected by your mental health. You guys be kind to yourself and have a great week. Bye-bye.